Behavioral and emotional challenges. Students who are receiving services in this category are individuals that oftentimes create some significant challenges for us within the context of the classroom. So take a few minutes and think about some of the students that you've met or students that you've known perhaps in the past, maybe even within the context of your own educational experiences, and think about some of the challenging behaviors that those individuals have displayed, and make yourself a short list. Make sure that you have about 5 challenging behaviors in your list. We're going to come back to this list later in the lecture. So, serious emotional disturbance, the IDEA definition is that it's a condition exhibiting one or more of the following characteristics over a long period of time. So this needs to go on for an extended period of time. It can't be a student who has an issue for a day, a week, a month. Usually the expectation is that it's gone on for a period of about 6 months and that it has a significant impact on the child's educational performance. So some things that we need to make sure that we're doing is we need to make sure that we eliminate any potential reasons for that child to be having emotional challenges that could be explained by intellectual, sensory, or other health factors. Many times students who have intellectual disabilities will also have behavioral challenges because of some of the challenges they have because of their intellectual disability. Some students who have sensory issues, whether it be a visual impairment or a hearing impairment, may also exhibit some challenging behaviors, but those are not necessarily to be considered serious emotional disturbance. And occasionally individuals have such significant health issues that are impacting their behavior that we need to take that into account as well to make sure that that's not the reason for this individual's emotional challenges. One of the first things that should be looked at when a student suddenly starts displaying emotional problems is to make sure that we've ruled out any kind of health challenge. With students that fit into this category of serious emotional disturbance, they have an inability to build or maintain satisfactory interpersonal relationships with peers or teachers. These may be students that have very few friends, if any, or the friends that they do have are friends that are also sometimes challenged in other ways. They may be described as hanging around with the wrong crowd of students, and sometimes they hang out with students who also get them into some kind of trouble. They're often students who have difficulty building relationships with teachers and other adults. These are the students that, unfortunately, if you spend any time in the teacher's lunchroom, you'll hear people talking about a student that they're having difficulty with and how hard it is for them to make that connection with them. They may have inappropriate behavior or feelings under normal circumstances. So they may seem to sort of overreact to situations. They may seem especially sad in a situation that is sad but doesn't necessarily warrant crying with great sobs and emotion. Or they may get really angry very quickly over a situation that should have just caused someone a minor amount of frustration. These may be students who have a sort of overall pervasive mood of unhappiness or depression. Other emotional challenges, other mental health issues would also fit into this category depending upon how that student is reacting to some of their mental health issues. Some mental health issues, the students will not have any outward challenges, and they will be things that we deal with under another category called other health impaired. But for students who have emotional challenges that are connected in with their mental health issues, they will probably get their services under serious emotional disturbance. They also have a tendency to have physical symptoms or fears associated with personal or school problems. So these are students who become incredibly stressed out over school situations to the point in which they are unable to actually function in those situations. They may become so incredibly anxious over a test or some other event that's coming up, much more than somebody's sort of appropriate level of nervousness about something. The term also includes schizophrenia, but it does not apply to children who are considered to be socially maladjusted unless it's determined that they also have an emotional disturbance. This is a fairly tricky category to sort out. There's actually a chart within the modules that you can take a look at to see what the symptoms of serious emotional disturbance are in comparison to what the characteristics of an individual who's considered to be socially maladjusted are. So the prevalence of emotional disturbance, according to the National Center for Educational Statistics, about 5% of students served under IDEA are labeled with emotional disturbance. This is data from the 2017-2018 school year. So on an average, about 5% of students at your school will be students who actually have a serious emotional disturbance. One of the things that is concerning about this particular category is in proportion to the percentage in the population, there is a disproportionate number of Black students labeled with emotional disturbance. And this needs to be looked at very carefully. Are we misinterpreting cultural and racial characteristics? Are we misinterpreting the way that students engage in ways that are considered appropriate for their culture? Are we seeing those as problematic behaviors as opposed to recognizing that they are not a sign of serious emotional disturbance, but they are the way that someone operates within their culture? Some things that we see that fit into emotional and behavioral disorders based on the DSM-5, the Diagnostics and Statistics Manual of the American Psychiatric Association, which is basically the psychiatric basis, and the psychiatric Bible, as some people may refer to it, for looking at whether someone actually has a psychiatric disorder. Some of you may recall during the course of the in-service for your teacher before you started school, the new student orientation period, I mentioned that probably every single person in the room could be considered to be an individual who had some type of hidden disability, whether someone has insomnia, whether someone has a phobia against spiders, whether an individual has bipolar disorder or depression or anxiety. We all have something that actually fits into one of these DSM-5 categories. Basic issue is how much does that impact our ability to function in day-to-day life. So the emotional and behavioral disorders that you may see within the context of your school, this is just a sample of them. There are some that would be considered externalizing disorders. These are things that you will notice, and you will notice them right away. They're very obvious. These individuals oftentimes have some fairly significant challenges that you cannot possibly miss. So attention deficit hyperactivity disorder is technically a DSM-5 diagnosis. The majority of the students at your school will probably receive their services. Those students who have ADHD will either receive services under the other health impaired diagnostic criteria of IDEA, or they may actually be receiving a Section 504 plan. They typically will not get their services under serious emotional disturbance unless, of course, they actually have some very significant behavioral issues. Oppositional defiant disorder is another thing that you may see students getting labeled with. You may hear folks refer to it as ODD. Oppositional defiance disorder may appear like teacher says, I would like you to do this, student says, absolutely no way. And a continual pattern of that, not being able to follow directions, not being able to function within the context of a schedule. But these are psychiatric diagnoses that need to be given within the context of a medical professional's office. A conduct disorder is actually a little bit more significant than the oppositional defiant disorder. These are individuals who you may find are committing crimes. They may be causing harm to animals. They may be doing a variety of other things that are kind of bordering on the them potentially getting themselves connected in with the juvenile justice system. An autism spectrum disorder is also an externalizing disorder. Individuals who actually have autism spectrum disorders will receive their services under the autism category, but I wanted to point out to you that it is an externalizing disorder. We will talk about autism spectrum disorders in the near future. Some internalizing disorders, and ones that oftentimes are much harder for us to pinpoint and to ensure that individuals are getting services, are things like substance abuse. The rate of opiate addiction in the United States and in the state of Connecticut is beyond, I think, anyone's actual understanding and ability to process at this point. We may have students who have alcohol addictions. You could have students who have a nicotine or a vaping addiction, which is currently another issue that we've been starting to take a closer look at. So those things may be issues that we need to keep an eye on. Feeding disorders are typically things that happen in much younger children, but eating disorders are things that you will see within the school-age population. And one of the things that we need to be cautious about is not interpreting a particular disorder or lack of disorder based on gender. There are as many young boys struggling with eating disorders as potentially there could be young girls, but oftentimes we overlook that. Many of the males' eating disorders are revolving around sports, making weight for particular sports. So it's really important that teachers and other individuals in the school are kind of keeping an eye on that. Anxiety and social withdrawal are certainly a significant issue. Obsessive compulsive disorder would fit into this category as well. These are students that you will see become quite visibly anxious and oftentimes will not feel comfortable in many social situations or will be incredibly concerned about things being a very particular way. Depression and bipolar disorder, the rate of depression in adolescence has grown significantly over the past 10 years to the point in which it's becoming quite alarming, something that we need to keep a very close eye on, something that's a little bit hard sometimes to determine in adolescence. There are certain behaviors that adolescents have a tendency to do where they kind of, they do sometimes seem withdrawn, they do sometimes seem like they might be depressed. Keeping an eye on that, watching for patterns, seeing if the behavior lasts for an extended period of time is important to do. The other thing to keep in mind is not everyone who is depressed outwardly looks depressed. Many individuals who are depressed have a capacity for being able to put up a good front, and oftentimes folks are not completely and totally aware of that. Bipolar disorder, you may know as manic depression. It's sort of the high side of the mood disorder, the very, very high, buzzing around, getting engaged in a lot of different things, being very, very active, not sleeping, potentially maybe not eating very well, sort of the polar opposite side of the depression and the withdrawal. Schizophrenia and psychosis are diagnoses that you typically will not see in a school-age population. The age of onset for schizophrenia for males is usually between 18 and 21, and for females it's usually a little bit after that point to the 20-21 age group. However, you may actually have a student who truly has a diagnosis of schizophrenia or psychosis. These are individuals who are experiencing hallucinations, delusions. They have situations in which they are completely out of context of what is going on in reality. This is actually a fairly rare occurrence within a school-age population, and oftentimes individuals use these words, especially psychosis, to misrepresent a student who is having difficulty. You may hear someone say, oh, that person is acting psychotic. Individuals who actually have psychosis are having experiences that are not reality-based. So, with this group of students who have serious emotional disturbance, one of the things that usually sets them apart from their peers is something called challenging behavior. And challenging behavior is a behavior that either will cause that individual some type of self-injury, could create an injury towards others, or some type of significant property damage. These kinds of problems get in the way of that individual learning. It gets in the way of that individual being independent, and it certainly gets in the way of that individual developing relationships. So one of the things that we need to keep in mind is that there are some IDEA requirements for individuals who have challenging behaviors. The IEP team, or as we know it here in the state of Connecticut, the PPT team, needs to consider the use of positive behavior interventions and supports for students who have behavior that is getting in the way of their learning or the learning of others. There is an expectation that a functional behavioral assessment will be conducted when that child does not have a behavior intervention plan. And if that child is removed from their school for any period of time, 10 school days suspension, or put into another situation that is not their typical situation, something that's considered out of their normal placement, that a functional behavior assessment needs to be done. Functional behavioral assessment is always best practices when you're trying to address a behavior that is getting in the way of a student's learning or the learning of others. What happens when you conduct a functional behavioral assessment is that you are looking to determine what the functional communication is of that child's particular challenging behavior. I've posted actually a functional behavioral assessment in the modules so you can see some of the types of questions that one would ask. Basically what we're looking for is trying to figure out, what is this child trying to tell us when they get upset? Are they trying to tell us that they're having difficulty with an activity? Are they telling us they're confused? Are they telling us that they're overstimulated? And those are all things that we should be trying to figure out. So, what is positive behavior support? It's a comprehensive strategy that strives to address challenging behaviors through a functional assessment, which we've already talked about, leading to the determination of the communicative function, so trying to figure out what is that person actually trying to tell me with this challenging behavior, and what it should do is guide a positive behavior change plan. So after I've conducted this functional assessment, after I've determined what the person is trying to communicate, I should be writing a behavior support plan that helps that person change their behavior. So if the student's challenging behavior is determined to be because they are confused and they don't understand something, what I need to do is find them a better way to let me know, I'm confused, I don't understand, I need more help. So there's some examples of functional behavioral assessments in the modules, so you can take a look at that. And here are some reasons why an individual may have exhibited a challenging behavior. Could be that they're doing something that we consider avoidance or escape. Avoidance would be engaging in the challenging behavior before the activity even starts. I'm completely unwilling to do this, whether that individual can actually express an unwillingness or not, but they see an activity coming, they know that it's problematic for them in whatever reason, and they try to completely avoid it. It could be that they get started with an activity. They maybe start some of the work that they're being asked to do, or they start participating in an activity and then become overwhelmed and try to find a way to escape the activity. Another thing that an individual may be communicating is a need for attention. There's a video here that demonstrates an individual trying to gain the attention of another person. So sometimes we're trying to gain attention from other people. It could be getting their attention so that they can provide me help. It could be, for some students, gaining attention from classmates because they find it to be engaging or entertaining. Some individuals will use attention to gain access to tangibles. So if any of you have ever been in the grocery store watching a family with a younger child who has decided that they want something off the shelf that the adult does not want them to have. Let's say that you're going down the aisle in the grocery store and this little person or this younger person wants a package of Oreos. And the mom or dad says, no, we're not getting Oreos. And then you watch that child fall to the floor. They're screaming, they're yelling, they're kicking their feet. You're the terrible parent. I can't believe you won't buy me Oreos. You're awful. I hate you. Whatever it is they happen to be saying or doing. It's very loud, very noticeable. If the parent puts that package of Oreos in the cart, more often than not, the child will pop up off the floor and just keep right on going. The only problem with that is now you've taught that individual that whenever I need access to something that I really, really want, then I need to do something that causes a pretty significant scene or a lot of confusion, and then you'll just give it to me to get me to stop doing whatever it is that I'm doing. The other thing that an individual may be doing is trying to gain access to an activity that they like. Had a student one semester who shared with me a story where there was a student who had some fairly significant academic challenges. I believe it was actually a student on the autism spectrum who was going into a general education classroom. Whenever the paraprofessional brought that student into the gen ed class and that student was presented with materials to work on perhaps a paper pencil task, the student started making some vocalizations. Not necessarily really loud vocalizations, but some vocalizations. The para interpreted that as, oh, that's a problem, the teacher's not going to be happy about that, and started taking this particular child out for a walk whenever he would start making a lot of noises. Well, unfortunately, what happened was he learned that whenever he wanted to go for a walk, which happened to be his favorite activity to do at school, was to walk around the building, he just needed to make some noises, and he would get to leave the room. So unfortunately, he learned how to get access to an activity that he likes by engaging in a behavior that others perhaps were not very happy with him engaging in. Another communicative function of a challenging behavior could be for self-stimulatory reasons. You may see students who rock. You may see students who do things like pick at their skin, or they may even hit their head on things or hit themselves in the head with their hands. Those could all perhaps be considered in some regards to be giving them some type of sensory stimulation. The communicative function of self-stimulation is really hard oftentimes to get to the bottom of, because you have to find another thing for that individual to do that gives them the same feeling that they're getting from whatever the challenging behavior is. Another self-stimulatory behavior could be considered cutting. And for many individuals who cut, they will tell you that they have a whole emotional reaction that goes with it. So trying to find a substitute for that can be sometimes quite challenging. And the last reason why an individual might be engaging in a particular challenging behavior could be either a medical or psychiatric reason. So an individual may have some psychiatric issues that cause them to become really, really anxious and lash out. Or you may have a student who has schizophrenia who is responding to something that is not there. So those are much more challenging to get to, because you can't really teach that person any kind of other behaviors. You just oftentimes need to just try to support them appropriately during that time period. So there's some information here about functional assessment. It's a video that you can watch that is on YouTube. You will find that the individuals it's a video that's a little bit old. It will become quite clear to you as soon as you see the individuals that are talking that the video is a little bit older, but the information is still completely accurate. So I would encourage you to take a look at that. As we're putting together a comprehensive behavior support plan or behavior change plan, some things that we need to kind of keep in mind is we need to think overall about that student's quality of life. What does their life look like? What kinds of things are going on for that individual? Do they have friends? Do they have a situation that perhaps we can't do anything about, but that we need to kind of keep in mind? Maybe that student is living in a fairly challenging family situation, or is in a situation where they have either food or housing insecurity. You have to take that into mind, because it's probably having an impact on the challenging behaviors that the student has. Some of those things we can't necessarily change. When students don't have friends, one of the things we can do is try to put them in situations where they have opportunities to develop friends. We certainly can't force children to be friends, but we can keep making sure that we move students around in our classrooms in enough different creative and clever ways that they have an opportunity to hopefully make a connection with a peer. Functional assessment we've already talked about. Antecedent interventions are things that we would do before we think there would be a problem. So if we know that a student gets incredibly upset and distressed and might, I don't know, run off or cause harm to themselves when the fire alarm goes off, then one of the things that we could do is try to make sure that when we know that there's a scheduled fire drill, that we are able to, a minute or so before it goes off, hand that student maybe some noise canceling headphones, or bring that student into another place where they are not as impacted by the fire alarm. Certainly there will be times the fire alarm goes off that we can't control for, but hopefully if we try to control for it as much as possible, we will cause that student less distress. Lifestyle changes are a little harder for us to help school-age children do. Many times, unfortunately, they do live in situations with people that perhaps they don't really like. Maybe they have some siblings they don't like so much. Maybe they have other family members living in their home that they don't like so much. Those things can be oftentimes very challenging for individuals, but oftentimes things that we don't have an awful lot of control over. The more skills the student has, the more likely it is that they won't need to use a challenging behavior to get their needs met. So overall, any new skills that the student learns, anything from reading to tying their shoes, helps them become more independent and more capable. Expanding their communication skills is getting them as many communication skills as possible, whether we give them some kind of picture communication system to use, whether we continue to work on students being able to verbalize appropriately what it is that they want or need. It's important for us to keep building communication skills. The more social skills the individual has, the less likely it is that they will engage in challenging behaviors as well. Self-determination and self-management kind of go a little bit hand in hand. Self-determination is the opportunity to be able to express what it is that you would want or need. So as we think about students being able to come into PPT meetings and tell the team what kinds of things they would like to work on, that could be considered self-determination. Could also be considered within the context of the classroom where the student advocates for themselves. Maybe ask the teacher to give them something in a different way, or advocates that they need some manipulatives in order to complete an activity, or that they need to maybe sit in a quiet space for a little while. Those could all be considered opportunities for that student to exhibit self-determination. Self-management skills are an opportunity for the student to try to help themselves figure out how to work through some things. So being able to remove yourself from a situation that you know is not going to be successful or is going to be problematic, to take that maybe a few minutes to step away to a quiet corner in the room, or sometimes older students will have opportunities to leave and go talk to a counselor. Another thing that can be helpful is asking students to kind of keep track of their own challenging behaviors. Their data collection will probably be inaccurate, but the more that they try to keep track of things themselves, the more likely it is that they will gain more self-management skills. Interventions related to environmental modifications. If we know that students have an incredibly difficult time sitting in a really noisy place, then unless it's absolutely necessary, we would try to avoid things like that. There are some students who don't do well in the lunchroom because there's just too much going on there. So creating a lunch bunch or another place for them to eat lunch that is quieter. One of the things that we want to try to make sure that we're not doing, though, when we do something like not have a student go to the lunchroom, is we don't want to isolate them. We want to try to create opportunities for smaller group types of social interactions. Emergency interventions, there should always be some kind of crisis plan for a student who has some significant behavioral challenges. There should be a crisis team at the school that is able to assist with that student when they are having some significant behavioral issues as well, especially students who have aggressive issues. The other thing that we need to keep in mind is that as we've implemented this behavior support plan, we need to keep looking at the data and we need to evaluate what it is that we've put in place. There may be times that a plan looks really good when it's first put into place, and after using it for, say, 3 or 4 weeks, it becomes clear that it needs a little bit of adjustment. So one of the things that's important is to make sure that we're doing those adjustments as needed. We don't want a student's plan to be outdated. Another thing that we want to think about is, some assumptions of a comprehensive behavior support plan. We've talked about many of these things already, but remembering that when a student has a challenging behavior, they are trying to communicate something. Hopefully kind of keeping in the back of your mind, this person is trying to tell me something. I may not necessarily know exactly what it is they're trying to tell me right now, but they are trying to tell me something. Will hopefully help you stop taking the challenging behaviors as something that's directed towards you personally. As I said earlier, increased communication leads to decreased challenging behaviors. An enhanced social environment helps promote that student's communication skills overall. Remembering all challenging behavior serves a purpose. Challenging behavior can occur when events are either internal or external environmental events may maintain it. So you may find that when you have a student who is starting to, say, get a cold, that they may be much less able to kind of keep their behavior under control, and they may get upset more quickly. There may be environmental things that trigger that individual to engage in a challenging behavior. We want to make sure that we keep in mind the broad context of that person's lifestyle. Again, as I mentioned earlier, some of those things we may not be able to do anything about, but there may be other things that the school social worker or other individuals associated with the school can do to help the family outside of the school situation. We also need to think about what's going on before and after that individual engages in that challenging behavior. What was going on before? Do we know what it was? Do we know that they got to the lunch line and the food that they really liked wasn't there, and that was why that student got upset? Well, then what happens after that? The antecedents and consequences are things that we can hopefully find ways to control for as much as possible. Our reaction to a student's challenging behavior can make or break that situation. The less reaction you have, the better. The more you start to get flustered, start to get upset, start to react to what that individual is doing, the more likely it is that we are going to continue to perpetuate that challenging behavior. The other thing that we need to keep in mind is that sometimes the reason for the challenging behavior may not be real clear to us at the moment. We may not know what happened when that student was on the bus. We may not know that when they went to go eat breakfast that morning that their favorite breakfast cereal was not available, and it kind of set the stage for the day to get off in the wrong direction. So sometimes it takes a little bit longer to try to get to the root of a particular problem. It could be something that's been building for weeks, depending upon the student. So we need to try to pull all of this information out. Putting together a functional behavioral assessment oftentimes is like putting together a puzzle. As you add more pieces to it, the picture becomes clearer. And just sort of as a good reminder, positive behavior support is a comprehensive methodology. It's not just the smiley face chart or the check marks. It's a much bigger type of approach. So as you went through this lecture, think back to the list that you made at the beginning. So what kinds of things could you do as a classroom teacher that impact or help that student change their challenging behaviors? You could address the question by thinking about a single individual at your school or from a more school-wide approach.